Welcome to the Fab Center for Innovation 21st Century Learning Community Interview Series. In each video, we hear from public health leaders about their work and what they've learned. I'm your host, Travis Parker Lee. Today, we explore how the Minnesota governmental public health system built and strengthened their relationships to improve public health across the state. Joining me today are Tarryl Clark, Committee Chair of the Minnesota State Community Health Services Advisory Committee and Board Chair and Commissioner for Stearns County, Minnesota. Nick Kelley, Public Health Administrator for the City of Bloomington Public Health Division, and Madison Anderson, Tribal Public Health System Consultant for the Minnesota Department of Health. Thank you all for joining us. Tarryl, what work is being done in the public health system to ensure that it works for all Minnesotans?
We want healthy communities throughout Minnesota where everyone has what they need to be healthy. That is not the case right now. So we're working together, state, local public health, and our advisory committee, also known as SHAC, to update our public health system to be seamless across the state, responsive to today's needs while anticipating future ones, and making sure it's publicly supported. To that end, we have an intergovernmental group of leaders, really the leadership of those three groups from the state, from local public health, and from SHAC, who've been meeting every other week to really listen to each other's needs, learn together, and try to choose a path forward collectively. We're not just partnering anymore. We're truly trying to co-create and share power, which is a different kind of thing. And to make that actually work, we're also doing a lot of our work through work groups. And that means we've got people from across state, rural, urban, as well as our state partners coming together to look into specific areas of this so we get buy-in and learn well from each other.
Nick, how are you all working on your relationships in the Minnesota public health system?
So SHAC, Local Public Health, and MDH, we've been working together for almost 50 years. It's a really dynamic team of that elected state health, local health, and it really is a unique thing we have in Minnesota. For this joint leadership team, there has been really intentional and diligent work that's happened over the last 2 years or so, where that team has come together. There's been a lot of trust building, relationship building, because the questions and the challenges we're trying to overcome are really complex. And so that team needed to be able to come together, build those relationships, and grow together to ask those hard questions. And they've been really intentional. There's not... The state doesn't lead those conversations. We don't lead those conversations from the local public health, or SHAC doesn't. We have a facilitator that's neutral. And so we're all in there as equals to try and work to improve the public health system.
Madison, how do the tribal public health system and the Minnesota Department of Health work together?
Within Minnesota, particularly within the Minnesota Department of Health, there's been an effort to strengthen tribal public infrastructure through true partnership. Federally recognized tribes have their own public health authority, and the Minnesota Department of Health is partnering with all sovereign nations to the extent that they're interested in partnering to develop a Minnesota public health system that truly fits the needs of all Minnesotans, including our tribal nations.
Tarryl, can you share some lessons you learned from working with tribes?
Some of what we have been learning is that the old processes didn't work very well for anybody who was a part of a sovereign nation, that we really do need to respect the sovereignty and listen and learn and take the time that is needed to grow relationships and trust, because many, many decades, shall I say centuries of distrust, understandably, have been there. We have got some good local areas that have worked very well with the sovereign nations, that they happen to share geography, and we're trying to build off of that. So we believe in listening, that us understanding the importance of the process being led indigenously, and that their learnings about what will help build the updated system, and us understanding and hopefully learning from them will actually benefit everybody. And that's probably one of the most important things that we can be doing right now. So while we'd love to go ahead and figure out how we could be really engaging in this work together now, we recognize the importance of their leading their own process and then us learning from them and with them.
Madison, can you explain what approaches and actions have been important in building partnerships with tribes in Minnesota?
What's truly been instrumental in developing partnerships with tribe at the state level has meant setting aside appropriate time and capacity dedicated to working on tribal issues. At the Minnesota Department of Health, my position, the Tribal Public Health System Consultant, is a recently developed position to better serve the tribal nations. Another one of those recent developments that has been instrumental in partnering with tribes at the state level has been the Office of American Indian Health. Having these dedicated positions that can listen to the community and take into account community expertise means that we will be better serving our tribal nations.
Nick, where does Minnesota go from here?
One of the things that we were fortunate in Minnesota is our legislators, with a lot of work at the state and local level, were able to pass some innovation funding 2 sessions ago. So there was around $6 million allocated to do innovative work in local public health to really test, try, experiment to see what works and how we can do things better. That's been pretty phenomenal to see. There's several projects that have occurred across the state, ranging everything from changing different ways we communicate to how we work with data to how we approach some of our systems. And it was one of those funding streams that let us try things, see if it works. And we've had some incredibly successful projects. We've also had some projects that ran into complications, but we learned a lot through all those things. And that's helping transform how we think about the next round of funding and innovate some of the approaches that we're moving forward. One of the data projects is going to change the way we think about how to do community health assessments and have, while it's a little bit more of a regional metro focus right now, it has tremendous potential for statewide transformation, which is something that this funding allowed to happen.
Thank you everyone for being with us today. You can visit the show notes for more information about the Minnesota governmental public health system and how they are engaging tribal nations. On behalf of everyone at the FAB Center for Innovation, thank you for watching.